provide the best possible care to a client, working holistically with other professions will result in better care to the client and reduced recovery time. Group communication encompasses the characteristics of therapeutic communication. In this speech, I will talk about why it is essential that health professionals foster skills in working in groups and teams. A group may be defined as two or more individuals who are connected by and within a social relationship. Groups come in three categories: primary, secondary, and therapeutic groups. A primary group is informal and structured around social processes. In a primary group, the relationship is automatic. This is because they may either be family or share a common interest. Primary groups are important to a person's self-concept. Secondary groups differ from primary groups and are the most common group used within an interdisciplinary healthcare team. Secondary groups serve a different purpose and structure, as well as having a planned, time-limited association. This group consists of a designated leader with a precise purpose. When a secondary group achieves the goal, the group will separate. The secondary group may form for one of the three reasons: to meet personally established goals, for the development of more effective coping skills, and as it may be required by the larger community system. A therapeutic group may offer a special forum for learning and emotional support. A therapeutic group may be used for the treatment of psychological problems and general medical matters. This group may meet once or on a regular basis. Phases of a group's life cycle consist of 5 stages. This phase of the group dynamics provides a framework. These stages of the group's life cycle are applicable to the 5 groups. Each part of the 5 sequential phases has its own set of tasks, which is built off the previous phases. The forming phase is the inclusion of orientation phase. This is when everyone comes together to form the group. All group members may be strangers to one another and rely on the leader for direction. Finding another common ground and learning about the group goals are emphasized. Minimal work in the forming phase is conducted, however, this is vital for the team to get to know each other to have an effective, evolving group. Following is the storming phase. Group members focus on power and control issues. Members may use testing behaviors to possibly get a reaction and test boundary with fellow group members and the group leader. The storming phase may be uncomfortable as there may be disagreements and comparisons of group member contribution. The successful resolution will lead to the development of group-specific norms. The norming phase sets standards evolved by the group members, accepted as the operational norm. Individual and group goals become aligned. If goals are not yet met, group members may hold persons accountable if the member fails to adhere to the expected behaviors. A majority of the task set is taken out in the performing stage. This is characterized by the interdependence and unity. Group members are comfortable with one another and allow for constructive criticism as everyone else feels valued and loyal. The final phase is the adjourning phase. This stage allows for the reflection and meaning of the group work over however long the time span. Group members may also make plans for future directions. Put simply, functional group role is the behaviours in which group members use to move towards goal achievement, or the task functions, and the behaviours designed to ensure personal satisfaction, or the maintenance functions. When balanced correctly, an increased group productivity will be achieved. Task and maintenance functions found in the group dynamics may include behaviours such as clarifying and initiating, and maintenance functions such as harmonising and compromising. All group members have the right to be listened to and respected. A lot like therapeutic communication, the way in which group members communicate may have issues or barriers. These barriers may be caused from bullying, be personal, or oppressive group behaviour. Possible strategies to enable effective group functioning may include the self-care of one's own life, taking responsibility for oneself, and resolving conflicts cleanly or fighting fair. There are 3 groups in which health professionals work in, which may include a multidisciplinary team, an interdisciplinary team, and transdisciplinary team. Healthcare workers on multidisciplinary teams Each work within their scope of practice and interact formally. Multidisciplinary teams do share information with one another in tandem, however function independently and being responsible for the client's different care needs. An interdisciplinary team consists of a core group of health professionals, which is usually a doctor, nurse, social worker, pharmacist, and caseworker. The core role of an interdisciplinary team is to be able to have the client's needs best values. This team develops a collective vision and common language to support the collaborative, unified working approach. An interdisciplinary team are greater characterized by the healthcare staff overlapping other staff's professional roles. Staff can still be formal and informal communal to lead to shared problem solving for good of the client. All staff has a clear understanding of their discipline as well as a knowledge and mutual respect for each other's disciplinary roles. A transdisciplinary approach is a lot like an interdisciplinary team. This team requires the team members to share roles and systematically cross discipline boundaries. The primary purpose of this approach is to pool and integrate the expertise of team members so that more efficient and comprehensive assessment and intervention services may be provided. The communication style in this type of team involves continuous give and take between all members on a regular planned basis. Professionals from different disciplines teach, learn, and work together to accomplish a common set of intervention goals for a client. The role differentiation between disciplines is defined by the needs of the situation rather than the discipline's specific characteristics. Assessment, intervention, and evaluation are carried out jointly by designated members of the team. Health teams are more common than ever due to practice being an integral service delivery and increasing specialisation of the emergence of new para-professions. An ageing population with frail older people and larger numbers of patients with more complex needs associated with chronic diseases, and the increasing complexity of skills and knowledge required to provide comprehensive care to clients. Over time, the changes in healthcare practices such as primary healthcare needs extra advanced knowledge. Healthcare teams aim to break down barriers that may exist between different professional groups. When applied to practice, it results in a state of equality and harmony within a team. Healthcare teams enable the learning of working together to respect one another, communicate information effectively, and very importantly, treat each other equally. This is able to be achieved once stop looking at the differences and focus on what made one another similar. It all comes down to one fundamental purpose we all share, to strive for a team to be able to work together efficiently. Skills may be required for a team to function successfully. For example, an elderly client that has broken a hip will require a long stay in hospital and needs the assistance of an interdisciplinary healthcare team to efficiently and effectively help the patient get back to close to full health as possible. Some examples of the skills may include identifying a leader who establishes a clear direction and vision for the team, while listening and providing support and supervision to the team members. Incorporating a set of values that clearly provide direction for the team's service provision. These values should be visible and consistently portrayed. Demonstrates a team culture. Provide quality client-focused services and with documented outcomes. Utilizes feedback to improve the quality of care. Utilizes communication strategies that promote intra-team communication, collaborative decision-making, and effective team processes. Provide sufficient team staffing to integrate an appropriate mix of skills, competencies, and personalities to meet the needs of client and enhance smooth functioning. Promotes role independence while respecting individuals' roles and autonomy. In addition, the need for teams to regularly invest time in the processes of team development and maintenance of team functioning to ensure that these competencies are fixed and acted in their daily practice. In conclusion, it may not always be easy and ideal working with a team environment. However, you will gain so much more skills and become a better communicator. Learning, education learning leadership skills along the way, and as well as gain knowledge.